Hello everybody, welcome to Dr. Chan's Minor Ailments Forum today. Today I would like to talk about a topic that's really heated on TV right now, which is the Zika virus. The reason I'm doing this video is because number one, I didn't know much about it, so I went to research on it, and thank you very much for GP update course. They sent us some information regarding this virus and how to deal with the situation if someone came across this virus or worried that they might have it. So I thought I'll read it and I'll share it with you so you know what to do to avoid catching this virus, and if you can't avoid it and if you suspect that you have it, what to do from then on. So interesting thing that I found out about Zika virus is this is not really a new virus. It was found in 1947 in Africa. There was a few cases then, but it's not a lot of them, so it wasn't really a big thing in the media then. But obviously, as you know, there's an outbreak of this virus, especially in South America and America region. And the women who contracted the virus and gave birth to babies, they tend to have what we call microcephaly, so it means small head or smaller brain. So it is quite a serious stuff, and that's why the WHO is very concerned about this and looking into how to prevent it, etc. Now, interesting thing about the Zika virus is carried by a mosquito called Aedes virus, Aedes mosquito rather, AEDES, and they mainly feed during the daytime and not at night. And you won't find them in high altitude, for example, anything more than 2,000 meter. So the incubation period of time is around 3 to 12 days, presenting with symptoms just like a virus really, like achy joints, and you might have a red eye or painful eye, you'll have a headache and a low-grade fever. And that doesn't last for long. It generally lasts from 2 to 7 days. So it's, I can see why people didn't know previously that they contracted a virus, because it could easily be just a normal virus, cold and flu viruses, etc. So interesting thing to think about is the locations, because these mosquitoes are not found everywhere, but they're actually affecting several areas in America, in the Pacific, and also Africa. Now, I'm not going to go through the whole list of the affected areas in the world, but you can look that up on the CDC website. So you type www.cdc.gov and type Zika virus, then you should be able to find out where this is more prevalent. Just name you a few examples. So in America, for example, in Brazil, Colombia, and also El Salvador, places like that, they're quite prevalent. And in Pacific Islands, Samoa is affected, and in Africa, the Cape Verde is also affected as well. So you're thinking, look, I really don't want to contract that condition, because maybe you are pregnant right now, or you're planning to get pregnant, or you actually book a holiday coming up to go to one of these places that's affected. What to do? Are you going to cancel the holiday? Well, apparently, according to WHO, they haven't formed any plan of stopping people to travel to these places yet. So they said it's still safe to travel as long as you take extra precaution. I mean extra precaution to prevent yourself getting bitten by mosquitoes. Obviously, consider using DEET spray or wear long sleeve, light, loose clothing, so you reduce your exposure to the mosquitoes. And remember, these mosquitoes tend to feed in the daytime. So let's say you have to go and you're a woman, what do you do? So apart from the precaution that I talked about, it probably is a good idea not to get conceived when you're out there, and also for 28 days after you come back to the country, just in case that if you had a virus, then you give it time to kind of move on and you're better, then try to conceive later. If you're a guy, they said that the risk of sexually transmission of this virus is relatively low, but if you've got a partner who might be pregnant or might have risk of getting pregnant, it's good to consider using extra precaution, for example, condoms. And also, if you don't have any viral symptoms for a period of time, and if you do have any viral symptoms that could well be related to the Zika virus, they would want you to use it for 6 months. So 28 days after return from Zika virus transmission area, if no unexplained fever or rash, or for 6 months following recovery from illnesses consistent with Zika virus, or if you've been tested positive for Zika virus. So if you're a woman and you're definitely pregnant and you have been to these high-risk places, they've got a flow chart that we can follow as doctors to help you to decide what needs to be done next, like testing wise. So let's say you've been back from one of these places and you're pregnant, and if you don't have symptoms, then we generally would refer you to have a baseline ultrasound scan of the baby. If the baby looks okay, then you might be offered a regular scan, maybe every 4 weekly, to make sure that there's no new changes. And if the scan is abnormal, obviously you'll be referred to the pediatric or fetal medicine unit for further investigation. Let's say if you came back and you've got maybe a viral symptoms, so you'll be tested for the virus first, which you can have the blood test in the GP surgery. Then the GP surgery can send it to a special unit to get your blood tested, and if the result came back negative, then you are managed as asymptomatic women, so you'll be offered a scan, maybe or have more repeated scan every several weeks to ensure that the development of the fetus is okay. And if you do have symptoms and you're tested positive for this virus, you get referred to the fetal medicine unit for treatment and follow-up, etc. So the bottom line is, remember, most important thing is to have precaution when you go out to these places. Make sure that you do everything that you can to prevent being bitten by mosquitoes, and remember that these mosquitoes tends to be more active during the daytime, and there's no current advice of not going out to this country yet, but you just have to be very careful. And if you are pregnant and you do come back from any of these high-risk country, it's probably worth having a chat with your GP and considering blood tests if you've got symptoms, and if not, considering having being referred for ultrasound scan to check the fetal development. So once again, these information I found them on GP update websites, and I found them really useful, but I'm pretty sure that you can find similar information on the CDC website as well. So remember, it's www.cdc.gov, and if you've got further queries, don't hesitate to contact your own GPs. So I hope that the information is useful for you today, and stay tuned, we'll keep you updated. Alright, bye bye.